Super. Without further ado, then let's get going. So the first thing that we're going to touch on is about Wegovy, which is one of the weight loss medications that we prescribe here at the Slimming Clinic, and people have heard lots about. And it contains the active medication semaglutide. We've talked about this on a couple of the other Facebook lives. Semaglutide is actually the drug, and Wegovy is the name for the pen that's licensed for weight loss. We all have heard about Ozempic as well, which was the pen that containing semaglutide that came out first, that was licensed for diabetes. So obviously, when these drugs come to market, they have lots of medical trials to assess how safe they are and how they work. But once they come to market, they also continue to have trials that look at lots of different elements about the drug. And one of the things that have come out of subsequent trials, when they've been looking at the positive effects of semaglutide or Wegovy on the body, is that they've noticed that or they've seen in the studies that people who have a cardiovascular risk, so a risk to their heart health, and by taking this medication, they get a 20% risk reduction in having a major cardiac event, so something like a heart attack or a stroke. So two quite big, quite scary medical issues to happen. Nobody, having a heart attack or having a stroke are quite big, significant health events. So what this means is that for patients who have a BMI of 27 or upwards, who've got a history of cardiovascular disease of some form, by taking Wegovy, not only are they going to hopefully lose weight through the way it works to help us lose weight, which in itself helps to improve heart health, but also alongside it, you're getting that additional extra 20% risk reduction in your chance of having one of those types of events. As I say, the ones that they're looking at is things like having a heart attack or having a stroke. So again, those real big, quite scary things. Now, why is this applicable? Why is this something interesting? Well, we know that being overweight and being obese can have effects on the body. And we know that sometimes those effects can be things like raising the level of inflammation in the body. And we know over time, they can have quite a significant effect on our heart health. It might be something as you've noticed that maybe your blood pressure's gone up, or you notice that maybe when you've had your bloods checked, your cholesterol, your triglycerides are going up. All these couple of things that might make you concerned about your own heart health. Or you might know that you've got a history of heart disease, maybe that you've had an issue before, maybe you've had a little scare, something like a mini stroke or something like that. So considering taking Wegovy now is an even better reason than just simply taking action for your weight, because you're going to get those benefits, but also we know now you're going to get those additional heart health benefits. So I think this is a really important thing for us to think about when, not only as doctors, we're consulting patients, when we're talking about which weight loss injection might be better for you, but also not only if it's yourself, but if you know a loved one maybe who's had a near miss with one of a scary heart health event, and maybe their weight is increased, then maybe it's worth sort of talking to them about it and saying, look into this. Maybe this is a time to think about starting treatment to kind of get that double benefit, that hopefully that reduction in heart health risk, as well as the extra reduction that you'll get from losing weight and improving your health, and hopefully changing your diet alongside it. So it's something that our doctors talk to our patients about when they come for consultation, but again, it's something to consider. And again, just to say with that, you do still have to have a raised BMI to qualify for it. So you need to have a BMI of 27 and above. But again, if you are somebody who has a heart health risk, or in your family, there's maybe quite a big family history of heart health risks, especially of cardiac events before the age of 60 in your first degree relatives, so parents or siblings, etc., then definitely worth when you're weighing up which medication is better for you. So absolutely, please do ask your doctor when you come to your next appointment, if you're here with us, or when you're deciding maybe if you're going to the online route of requesting medication, when you're weighing up which medication might be better for you. If there is a history of heart health, then maybe it might be better to consider Wegovy for your treatment.